Surgery on the eye is delicate work that requires ophthalmologists to study and train for years. A bill in the Texas legislature this week would give that right and broader prescriptive authority to optometrists without the same amount of training. Several ophthalmologists told lawmakers on the House Public Health Committee Wednesday that the proposal, House Bill 2340 by Representative Stephanie Click, is unnecessary and bad.
The message from our standpoint is patient safety and making sure that people who are prescribing medicines and operating on eyes and eyelids in the state of Texas are properly trained and qualified to do that.
The committee took no action on the bill. Children insured by Medicaid could have continuous 6-month periods of coverage under a bill considered by lawmakers this week. House Bill 290 would eliminate the current burden on parents to submit monthly income eligibility proof to keep their children insured. Houston area pediatrician Dr. Lindy McGee supports the Medicaid extension and asked the House Human Services Committee to pass the bill for Texas families.
The importance of extending the eligibility is just to reduce the burden on families, on offices, and to make sure that the kids are getting the care they need.
An estimated 50,000 Texas children have their health insurance interrupted each year due to red tape.
Today I rise to recognize and honor the many Texans in the medical community who lost their lives in service as frontline workers during COVID-19.
Tuesday, the Texas Senate paid special tribute to physicians and healthcare workers on Doctors' Day. Senator physicians Buckingham, Donna Campbell, and Charles Schwertner sponsored the Senate resolution. TMA President Dr. Diana Fite was there to represent medicine.
I just want to join all of you and thank those fallen members of the medical community, as well as their friends and families, for the sacrifice that they all made shepherding Texas through this pandemic.
It was wonderful that the Senate and the senators recognized physicians and our healthcare colleagues who have been dealing with COVID, and in particular, those who have passed away.
The Senate Finance Committee unanimously passed a TMA public health priority bill this week. Senate Bill 248 would require retailers to obtain a state permit to sell e-cigarettes and follow the same rules used to sell tobacco products to customers 21 years of age and older. It would build on the Tobacco 21 law passed last session. Dr. Lindy McGee once again testified for TMA, the Texas Pediatric Society, and the Texas Public Health Coalition that expanding state tobacco sales permits to include vaping products could reduce teen access to them.
So the important aspect of this bill, Senate Bill 248, is to make sure that everyone who is selling nicotine products is permitted to sell those products. And that way, enforcement agencies can go in and make sure that they're following laws like Tobacco 21, not selling to minors.
Teens who vape are more likely to become cigarette smokers than their non-vaping peers. This bill is now eligible for the Senate calendar.
And remember all these priorities.
This Tuesday, April 6th, marks TMA's First Tuesdays at the Capitol Advocacy Day this session online. TMA physicians, Alliance members, and especially medical students this time can register now to attend virtually. Scan the QR code for info and to register for one of 2 virtual sessions Tuesday at noon and 6 p.m. Each event lasts just an hour. Sign up to learn how to advocate for medicine.